Instant neuro! Hearing loss. Recall the three parts of the ear: the outer ear, middle ear, and inner ear. In terms of hearing loss, disruption to the function of the middle ear is associated with conductive hearing loss, and disruption to the function of the inner ear is associated with sensory neural hearing loss. To determine the presence, location, and nature of the patient's hearing loss, it is necessary to perform two hearing tests in combination. The first test is called Rinne test. The Rinne test compares perception of sounds transmitted by air conduction to those transmitted by bone conduction, thus screening for the presence of conductive hearing loss. To perform this test, the activated tuning fork is placed on the mastoid bone behind the ear. When the patient can no longer hear the sound, the tuning fork is moved and held in front of the pinna of the external ear. In the normal condition, air conduction is greater than bone conduction, that is, AC is greater than BC. This means that the patient can hear the tuning fork next to the pinna after they can no longer hear it when it's held against the mastoid. In the case of conductive hearing loss, bone conduction is greater than air conduction, that is, BC is greater than AC. Therefore, a patient with conductive hearing loss would be unable to hear the tuning fork after it is removed from the bone. The second test is called Weber test. The Weber test can detect unilateral conductive hearing loss and unilateral sensory neural hearing loss. To perform this test, the activated tuning fork is placed equidistant from the patient's ears on top of thin skin in contact with the bone. If the patient perceives sound to be equally received by both ears, then there is no unilateral hearing loss. The patient either has normal hearing or bilateral hearing loss, that is the same in both ears. If the patient perceives sound to be unequally received by both ears, then unilateral hearing loss is present. For this test, a patient with unilateral sensory neural hearing loss would perceive less sound in the affected ear. A patient with unilateral conductive hearing loss would perceive greater sound in the affected ear, as there is no sound wave loss conducted to the eardrum from the middle ear. Treatments for conductive hearing loss include hearing aids or, in some cases, surgery. Treatments for sensory neural hearing loss may be hearing aids or cochlear implants. A cochlear implant functions by directly stimulating the cochlear nerve. Conversely, hearing aids are capable of amplifying sound waves only. An acoustic neuroma, also known as a vestibular schwannoma, is a tumor of the myelin-forming cells of the vestibular cochlear nerve, cranial nerve 8. This condition can result in a range of symptoms including hearing loss, difficulty with balance, and tinnitus. Tinnitus is Latin for ringing, and is the perception of sound when no external sound is present. Many conditions are associated with tinnitus, however the most common cause is noise-induced hearing loss. Instant neuro!